Hello, bonjour. Hi, Paul, can you hear me? Yes? Wonderful. Hello, bonjour. First, some quick comments on the Prime Minister's announcement today with respect to vaccines. There's no question that we are all waiting with bated breath for vaccines to come to Canada. We are in the second wave. Here in Ontario, we have seen another record day of infections and record days of infections in other parts of the country. And so clearly, we are all excited about the prospect of a vaccine being available and ready for distribution as soon as possible. As we approach that point, we need to keep in mind that it is absolutely critical that we maintain the maximum level of confidence in the vaccine itself, in its distribution, and in the prioritization. And so what that means more than anything else is that we have got to keep politics out of the vaccine process, the distribution, and the approval process. Nous sommes toutes très hâte de voir une ou plusieurs vaccins disponibles ici au Canada. Nous sommes maintenant dans la deuxième vague. Nous aurons des fêtes sans notre famille, sans nos familles. Alors, tout le monde a hâte qu'il y ait un vaccin et que le vaccin soit distribué. Mais en ce moment, il faut absolument assurer que le peuple au Canada ont le maximum de confiance dans le vaccin, dans la priorisation des récipients et aussi dans la distribution. Et pour accomplir ça, il faut absolument assurer qu'il n'y a pas de politique dans notre processus de distribution, de priorisation des vaccins. And so I feel like today's announcement in that respect was a bit of the cart before the horse. We have not approved the vaccine yet. And so it seems to me that given how soon the vaccine may be approved, that we might have waited until the vaccine was indeed approved in order to announce the distribution of the 249,000 doses. This is, of course, to ensure, to make it clear to people that we have a very robust approval process and that there is no consideration other than the safety of the vaccine, which is, of course, the case, but would have been reinforced had we waited until the vaccine had been approved for such an announcement. In the interim, there is a lot that we could have done. Had I been in the place of the Prime Minister, I would have taken this time to brief the leaders of the opposition parties. We had one very productive briefing, and it would have been very helpful if we are truly seeking a Team Canada approach to have been briefed in advance of this announcement. There is a First Minister's meeting later this week, and of course that would be the time to again meet in a spirit of cooperation to talk about who is going to get these 249,000 doses, how they're going to be distributed between the provinces, who is going to be prioritized, what the logistics are, all questions that still remain unanswered as of today, and might have been answered, might be answered later this week and could have been coordinated with this announcement. And then finally, I think these kind of announcements, and we've seen this in other countries, they're better placed to be made by the public health officials and the logistics officials that have been tasked with doing this non-political work. Whenever we have these sorts of announcements being done by political actors, again, there is always a risk of the perception of it being politicized. And in the case of opposition parties, our case accepted, the temptation to politicize something which really should not be. Alors, à mon avis, il aurait être mieux pour notre Premier ministre d'attendre l'annonce de l'approbation des vaccins, d'un vaccin ou plusieurs vaccins dans les prochains jours avant d'annoncer la disponibilité de ces 2049 000 doses du vaccin. Et il aurait pu utiliser le temps pour parler avec les chefs des autres partis, de parler avec les premiers ministres des provinces et territoires et de présenter un plan pour la distribution et la prioritisation de ces vaccins. Et en plus, je conseille le Premier ministre au futur de laisser les annonces sur la distribution des vaccins, la disponibilité des vaccins aux experts. Et comme ça, d'assurer qu'il y a plus d'une ambiance de neutralité et qu'il n'y a pas de tentation d'utiliser ces annonces pour des motivations politiques. And then coming to the reason that we call this meeting today, we want to remind our government that we are still in a second wave. We are in the grips of it, and we don't know yet exactly when we are going to exit it. We are entering a very lonely holiday season for many people who have been lonely and isolated for months and months, and we certainly aren't looking for any more reasons to cause them any stress or alarm. And so you can imagine, and this is why Paul Manley and I are holding this press conference today, you can imagine our concern when Paul Manley and the other members of our caucus heard from their constituents last week that they had received letters from the Canada Revenue Agency demanding that they repay CERB payments that they had received in error by the end of this month. Now, we all know that in the early days of the pandemic, the decision was made across party lines, and rightly so, that the Canadian Emergency Response Benefit should be available quickly. It should be available quickly, and we should make sure that people do not fall through the cracks and that they had the help they needed as quickly as possible. Et ça, c'était absolument le bon chemin. Parce que si nous avons tardé, il y aurait eu beaucoup de personnes ici au Canada sans le relief nécessaire, sans l'argent pour payer pour leurs besoins urgents. But when we did that, we knew that there were going to be some inaccuracies. We understood that there were going to be people applying in good faith for benefits that maybe perhaps were not ultimately intended to receive those benefits. And so to send them a notice in December, just as we're entering the holiday season, and while we're in a second wave, demanding payment within a month to people who may end up having payments of up to $14,000 is simply not in the spirit of this moment. We need to see people through all the way through, and we are not through this yet. And so what we are asking for very simply, and we're approaching this again in goodwill and good faith, we are asking the government to please suspend these demands for repayments until the new year and until the Canada Revenue Agency has the opportunity to propose a much better, much more compassionate plan that reflects that there was reasonable misunderstanding of what some of the provisions and eligibility requirements were for the CERB. C'est le moment de prendre une pause. C'est le moment de demander à notre agence de reconsidérer comment ils allont demander le repaiement et s'il même va demander le repaiement du PCU, parce qu'on sait qu'il y a beaucoup de gens qui ce n'était pas très clair quelles étaient les conditions pour recevoir le PCU. C'est la chose à faire pour reconnaître que nous sommes encore dans la pandémie, dans une deuxième vague. Ce n'est pas le moment d'aller rechercher ces fonds. Et je suis absolument sûre que tous les partis verts et les autres, allons travailler avec le gouvernement pour trouver une solution. I'm sure that all the parties are very happy to work across party lines to find a solution, because no one wants December to be a month of additional anxiety and stress for people in Canada. And I would underline that there are other sources of revenue that the Canada Revenue Agency has not fully tapped that would be a better place to go searching for those first dollars. And I'll point out that in the fall economic statement, we still did not introduce a plan for taxing our web giants. So maybe we want to look there first before we start looking in the pockets of Canadians of modest means who applied in good faith and are now being asked to repay over $10,000 in many cases. And I'm going to pass it to Paul Manley, and I'd like him just to explain what this looks like, because sometimes in the political bubble, you can forget that there are real faces and real people at the end of these stories and the end of these requests that we're asking about. And Paul, as one of our MPs, has heard many of these stories, and he's just going to share one to give people an idea of what we're talking about. Paul?
Well, thanks, Annamie. I've been getting a number of calls into my office, as has the honourable member from Fredericton and Saanich Gulf Islands, Elizabeth May and Jenica Atwin. Many of these cases involve people with home-based businesses. They're self-employed. They understood that it was their gross income, not their net income. And when you think about a gross income for a home-based business, you're able to write off part of your home, part of your rent, part of your utilities, things that you actually rely on to survive. And in some cases, there was a case in Fredericton, a young man was told by an EI agent that he was eligible and now is expected to pay back the money. And this is somebody with low literacy levels. In Saanich Gulf Islands, Elizabeth May's riding, a widow with a teenage daughter who has a lot of health issues, has a home-based business making things that crafts and things that they sell at the farmers market, and of course not able to do that in this time, but again understood that they could apply based on the gross income and then fell below the $5,000 on the net, and now is expected to pay back $14,000. In my riding, I have a number of people with diverse abilities, a couple of people who are actually, that get provincial disability, which allows them to earn $12,000 a year before that disability payment gets clawed back on them. And they have home-based businesses. One of them's in tourism, and they went with the gross amount again, and they're using again the gross amount includes helping them pay their rent, helping them pay their utilities, and helping them cover the cost of their businesses. Now, these people are expected to pay back $14,000. I don't think that you can ever expect them to pay back $14,000 because they get their disability payments. They're allowed to earn $12,000 a year above and beyond that before their disability payment is clawed back on them. How do we expect that these people are going to be paid back? And so I would just like to echo the words of Bonnie Henry, our public health officer here in British Columbia, and remind the CRA to be kind, to be compassionate. We are in the darkest time of year. Christmas can be a difficult time for people, but during the second wave of the pandemic, people are isolated. The Canadian Mental Health Association has said that the people who think about suicide has gone up from 1 in 40 in 2016 to 1 in 10 during this pandemic. And we need to be very, very careful with people. We need to be compassionate, and we need to show compassion when we're dealing with these issues. And I think they need to be dealt with on a case-by-case basis, but we need to put this off. There is no rush to get these funds back now.
Alors, le Parti vert, hier, nous avons envoyé une lettre à la ministre du Revenu national, Madame Leboutier, pour vraiment prier que les remboursements des prestations soient suspendus. Exactly because this is a time for compassion. I mean, this is just a no-brainer. We hope that bringing this to the attention of the government is enough for action. We absolutely do not want the government at this time to be the reason that people are pushed over the edge. And we do not want this to be the time to add to anyone's despair when many people are feeling that. So this is again another example of where we can work across party lines. We can make sure that we're putting people in Canada first, and we can make sure that people in Canada know that we are going to be with them until the very end, until we are all the way through this. And with that, I open it to any questions.
OK, we'll start the question period. Nous allons maintenant commencer la période des questions. As usual, one question, one follow-up. We'll start with 3 questions on the phone before turning to the room. Comme d'habitude, une question et une question de suivi. Nous allons commencer avec 3 questions au téléphone avant de prendre dans la salle. Please identify yourself before asking your question. S'il vous plaît, identifiez-vous avant de poser votre question. Operator, could we have the first question on the phone, please?
Thank you, merci. Please press star 1 at this time if you have a question. S'il vous plaît, appuyez sur étoile 1 maintenant pour poser une question. There are no questions registered at this time. Nous n'avons pas de questions pour le moment. I would now like to turn the meeting back over to you. J'aimerais maintenant retourner la parole.
Sure. Yes, Lee Berthiaume from the Canadian Press. I'd like you to know your message to people, some of whom would be your political supporters, who are doubting the science behind the vaccine. And what about those who mistrust it because of systemic racism in healthcare?
That's an excellent question, and it's exactly why I am saying today, and I've said over the last number of weeks, that we need to remove any sense that politics is a factor in the vaccine, whether it is in the production, in the approval, in the distribution. We want to make sure that there is the maximum confidence in the vaccine. We know that there are epidemiologists and other health experts that have already sounded some alarm bells about the what they call vaccine confidence rate within certain at-risk communities, exactly because of historical experiences with government distributed vaccines. And so we don't want to do anything that could feed misinformation. We don't want to do anything that is going to undermine confidence. And what that means is we need to make sure that the whole process, as much as possible, remains in the hands of the healthcare officials and the experts, that it is not politicized in any way, and that we speak with one voice. And so it is much easier to speak with one voice when we know what is happening. It was a very good first step for the Prime Minister to invite the leaders of the opposition parties to a briefing with Dr. Tam. That's something that I think should be weekly until we get through this. We cannot speak about what we do not know, and I don't think it's productive for us to be finding out about 249,000 doses arriving in Canada next week at the same time as everyone else. And of course, the provinces and territories and the ministers of those, premiers of those, they are going to play a critical role because they are going to be deciding who receives the vaccine and pretty much when. And so also working with them in advance and letting them know what there is to be known can help. I believe there's going to need to be a very significant public education campaign, and it's going to need to be, as I said, as cooperative and across party lines and united as possible. This is why we need national strategies, and this is why we need a unified approach.
And as to follow up on that, do you think as part of that education campaign that the government should focus or target its communications around vaccines to ensure that people, for whatever reason, perhaps because of systemic racism, because they have questions about science, whatever, do take up the vaccine? Basically, do there need to be targeted kind of messages to different groups of people, do you think? And before I let you go, both you and Mr. Manley, do you both intend on getting the vaccine as soon as you are eligible?
There will absolutely need to be targeted campaigns, and I know that there are already discussions, at least amongst the health community, about what that might look like. We have a not just in this country, but in others, but we certainly have a difficult and painful history in terms of the healthcare decisions and how vaccines and other treatments have been distributed amongst communities in the past. There is misinformation out there. There is doubt. There is confusion. There is mixed messaging. And so to ensure that the most at-risk communities, which often are also the communities that have the most doubts about and least confidence in the healthcare system, to make sure that they actually take up this vaccine, we have got to make sure that we are speaking with a unified voice. And certainly, we have to make sure that the messages that we are sending out address the specific concerns that those communities have. There's no doubt. With respect to myself, and I'll let Paul answer the question, my mother is 84 years old, and I don't think I have been in the same room with her more than a few times since this pandemic began, because she has underlying health conditions that puts her at risk. And I am just one of millions of stories like that. And so my first concern is making sure that those people who are most at risk get the vaccine. I support that. I want to make sure that there is every confidence in the system. So first in line really are people like my mother. We're looking at people in long-term care facilities, seniors over the age of 80, people in remote communities, Indigenous communities. I would also like to see added to the list those who live in hyper-concentrated urban environments, really vertical cities that have seen absolutely staggering rates of infection. The riding that I ran in the Toronto Centre by-election, this is a riding where you have certain pockets where between 7 and 10% of the residents in those communities who are low income and racialized, they are infected with COVID. And these are the people doing the essential work in our communities. So I would like to, this is where diverse representation matters because we know that those communities are particularly at risk. I would like to make sure that they also are prioritized during the vaccination distribution, the early phases of vaccine distribution. Paul?
Well, thank you. I just had my flu vaccine this weekend. I waited in line until other people who are more vulnerable than me were able to get it, and I will do the same thing with the COVID vaccine. I put my trust in science and look at the research. And I know people are worried about this, but we can't have a mandatory vaccine. I don't think that would stand a charter challenge, but people need to be reassured and understand that the science is there. There's going to be a variety of different types of vaccines, and I think that our job, politically, is to follow the science, make evidence-based decisions, and reassure people that it's the right thing to do when we know it's the right thing to do. And I'll get a videotape of me getting my shot when I get it.
And to that respect, just to underline again, I really would encourage, we're so close to the Health Canada process being wrapped up in terms of review of the most promising candidates for vaccines. We are so close. So let's get over the finish line and let's stop with the announcements that could muddy the water and confuse people. Because if we're talking about receiving a certain number of doses of vaccines prior to approval, that simply doesn't help. And since we really are within days of being able to, most likely being able to announce that approval and then announce whatever plans there are to distribute this very, very, very limited number of vaccines that are apparently going to be available in December. Let's make sure that we get the order right so that we can really ensure that there's as much confidence in the system as we possibly can have. Because it's pointless to ignore the questions that are out there. We do know that there are people that are questioning. We don't want to do anything to give them more reasons to question.
Operator, are there any more questions on the telephone, please?
Thank you. Merci. Once again, please press star 1 if you have questions. De nouveau, n'hésitez pas à appuyer sur étoile 1 pour toute question. There are no questions registered at this time. Nous n'avons pas de questions pour le moment. I would now like to turn the meeting back over to you.
Okay.
Maintenant retourner la parole à vous.
Sure,
Merci.
sorry,
Thank you.
just a follow-up. I may have missed it, but I don't think I heard you say you would get the vaccine. I understand what you're saying about others being a higher priority. Totally understand that, but when you are eligible, when it is your turn, will you get the vaccine?
That's right. When it's my turn. So in terms of the vaccine, when I want to be very clear about this because we have many, many months to go. I have no intention of, nor should I jump the queue in any way. I want to make sure that every single person who is even slightly more at risk than me is able to receive the vaccine before I do. But I have confidence in our process. I have confidence in our review procedures. When there is a vaccine and when all of those people have received their dose, then I will absolutely have my vaccine. Thank you.
Conférence de presse. Merci beaucoup.